Hello, good evening. I'm Ellis Dean, your host from blackdoctor.org. Thank you for joining us for this community conversation about an important topic for everyone 65 and older, and even those getting close to that age. Our topic tonight is Medicare, specifically how to navigate Medicare enrollment. We are back with another panel in partnership with Cedars-Sinai as we discuss the basics of Medicare and answer your questions about enrolling in, changing if necessary, and using your Medicare benefits. Today's discussion is also available via simultaneous interpretation in Spanish on our Daily Vida Mena Facebook page. We're talking about Medicare because, frankly, it can be confusing. Medicare is a government national health insurance program in the United States. It began in 1965 under the Social Security Administration and now administered by the Centers for Medicare and Medicaid Services, also known as CMS. It primarily provides health insurance for Americans aged 65 and older, but also for some younger people with disability status. To help us make sense of Medicare and Medicare enrollment, we have some great panelists joining us tonight. Let's meet them. First off, we have Dr. LaShawn McKeever. Dr. McKeever is the Director of the Office of Minority Health for the Centers of Medicare and Medicaid Services. Welcome, Dr. McKeever.
Thank you. Glad to be here.
We also have Bruce Young, and he is the Director of Managed Care and Payer Relations at Cedars-Sinai.
Good evening.
Good afternoon, Bruce. I know you're on West Coast, so good afternoon, Bruce.
Right. Thanks for having me.
And finally, but definitely not least, we have Miss Betty Goodman. Miss Betty is in her 70s. She's in Cleveland, Ohio. She's a resident there in Cleveland who has been on Medicare for a while now, and she's here to share her experience with initial enrollment, open enrollment, and this whole Medicare process. How are you doing, Miss Betty?
I'm doing good today. Thank you.
Well, we've got a lot to talk about today, so we're going to go ahead and get started. But the last thing I want to say is a little housekeeping. Number one, we'd like to know where you're watching us from. So if you would please drop in the comment section what city and state you're watching this from. Please do that, and so we'll try to give you a shout out as much as possible. Also, if you know somebody that needs this information, if it's a mother, grandparent, aunt, uncle, somebody in your family that could use this information, please tag them or share this on your page so they can get this valuable information. And then finally, if you have any questions that come up throughout the program, please drop those in the comment section as well. And we will try to get as many of your questions asked and answered at the end of the program. So I think I've done all the housekeeping. So we're going to jump right in this, roll our sleeves up, and try to unpack Medicare. So, Dr. McKeever, why is it important for you, the Director of the Office of Minority Health for CMS, to be out here tonight talking about Medicare enrollment?
Well, first of all, I'm going to start by saying thank you so much for having me tonight. We love to do these events with you all and to work directly with those looking at Medicare and healthcare.gov, health coverage. So CMS is the nation's largest health insurer, and we cover 150 million people across Medicare, Medicaid, and CHIP in the marketplace. And right now, millions of people on Medicare, whether new to Medicare or if they've been in Medicare a long time, are able to look at their plan and make sure they're on the right one. And we know that a lot can change. The plans might change, but your needs might change too. Be it a specialist that you need, certain prescriptions, or what you can afford. So it's important to shop around and look at plans and be sure you're in the right one and an affordable one. But to your point, CMS is committed to advancing health equity, and my office is tasked with helping ensure health equity is a part of everything CMS does, and that includes Medicare enrollment. So we're thinking about how this affects people of racial and ethnic communities, people with disabilities, people in rural communities, LGBTQ plus I populations, those impacted by language access, and others affected by poverty and inequity. So each of these groups may have a hurdle or barrier, and it could be finding providers in their area, affording their prescriptions, or being affected by worse health outcomes. So we need our listeners tonight to think about themselves as well as who in their family or community might need a little extra help to be encouraged to shop for plans, or maybe you could help them connect with someone, connect them to help. So I'm grateful to have this chance to talk about these important plans, applying for financial assistance in your state, or learning about other savings like with insulin. So again, thank you so much for having me tonight, and I'm excited to engage in the dialogue.
No, that is fantastic. That's one of, and it's important. I think that's a really important point to make, that leadership throughout the Office of CMS and throughout the Office of Minority Health are here. It's very important across the board for them to be engaged with the community, to get people enrolled. And so I just want to say thank you again for giving us this time this evening. So we have a large audience. As you can see, people are already rolling in. Thank you, people, for dropping. We got LA is in the house. We've got some people from Florida. I saw some Pennsylvania, Virginia. So please keep repping your city and state there. But so we have a large audience watching us here, and some of them might be eligible to sign up for Medicare for the first time. Can you give us a basic rundown of when you should sign up for Medicare?
Sure. So generally, most people enroll in Medicare when you turn 65. So this is called your initial enrollment period. It lasts for 7 months, starting 3 months before you turn 65 and ending 3 months after the month you turn 65. So certain younger people may be eligible before 65 due to a disability. To enroll in Medicare, most people need to contact the Social Security directly. It's recommended you do this before your 65th birthday to avoid a lapse in coverage and avoid penalties for applying late. So you should receive a packet in the mail from Medicare before you turn 65. And you can enroll online, in person at the Social Security office, or by calling Social Security at 800-772-1213. So again, you have a 7-month window around your 65th birthday to enroll, called your initial enrollment period. And after that, you can still enroll in Medicare, but you may need to wait for a designated special or general enrollment period to do so.
Dr. McGeever, could you give us that number one more time? I want to make sure our listeners got that number.
Yes, that number is 800-772-1213.
Great. And we'll have that posted on screen at some point throughout tonight's broadcast. We'll make sure that you all will get that number. So next question, because I'm getting close, as you can see from the, gray hairs on my face. I'm getting, closer to the day. It's not quite there yet, but getting closer. So when you sign up for Medicare, what exactly are you signing up for?
Okay, thank you. And that's a wonderful question. I know that, in your opening remarks, you talked about that sometimes it can be a little confusing for folks. So consider this a 101 tonight that hopefully will provide key information. So I'll start by saying that Medicare has 4 main parts: A, B, C, and D. So parts A and B are often referred to as original Medicare, and this is a fee-for-service health plan operated by the federal government. Part C is called Medicare Advantage Plan or Medicare Health Plan, and individuals may purchase these plans through private insurance companies approved by Medicare or their certified independent insurance agents. You also have an option of getting prescription drugs or Part D coverage called a Part D plan. And lastly, if you do not elect to purchase a Medicare Advantage plan, you may purchase a Medicare supplemental insurance, which is referred to as Medigap, to cover out-of-pocket expenses that Medicare does not cover. You cannot enroll in both Medicare Advantage plan and a Medigap plan. So just making that note. And you must also be enrolled in Part A and B to sign up for Part C, or Part A and or B to sign up for D. I know that's a lot of information, and you can go through some of this on our website as well. We have resources for that. So.
Wow. Okay. So yeah, I've heard I've heard the alphabet soup before, the ABC. So we just learn your ABCs, folks. And if you can learn your ABCs, you will be able to help yourself navigate through this process of signing up for Medicare. So, all right. So how do we pay for our premiums? I know that's always a dirty word when we talk about insurance, premium. So how do we pay for our premiums?
Well, most enrollees do not pay a premium for Part A because they or a spouse paid into the system for the required term via their FICA deduction on their paycheck. So those who haven't met the requirement pay an adjusted monthly premium based on employment history. Part B premiums are typically deducted from enrollees' Social Security deposits, or if you are one of the many eligible people who continue to work and choose not to take your Social Security at age 65, you can pay your premium via a regular bill. So for Part C, those Medicare Advantage plans that I talked about earlier, you may or may not be charged premiums based on your income and benefits offered. So it's important to look at all your options and meet with the licensed insurance broker to weigh each plan and the cost versus the benefits offered. And then for Part D, if you are a higher income person, you may pay an additional monthly premium. So again, it's important to discuss your specific needs with the licensed insurance broker or senior health insurance counselor to find a plan that works for the medications you take on a regular basis. But also, I want to be sure to talk about the Medicare savings program. That is where you can get help from your state to pay for Part A and Part B premiums. For some people, it also means the deductible coinsurance or copays are covered as well. So we encourage people to apply for this through their state, even if they don't think that they qualify for it.
Excellent. I just put that information on the Medicare Savings Program into the comment section. So if you want to learn more about that, well, don't do it right now because we want you to continue to watch this program, and we got to hear from Ms. Betty and Bruce. But later on, save that link, and it's in the comment section, so you can follow that link and learn more about the Medicare Savings Program that Dr. McKeever just talked about. So we're going to keep it moving. So will you please talk about some of the help that's available from each state, such as the health insurance assistance program?
Sure. So I'll start with California, where Cedar Sinai is. So the program is run by the state Department of Aging, but every state has resources available. And your state's senior health insurance assistant plan in California, that is, and I HIC cap. I don't know how you call it. Bruce. How do you call that in California?
Yeah, it's high cap or the Department of Aging. Yeah,
There you
exactly.
go, high cap. So high cap provides free, confidential, one-on-one counseling, education, and assistance to individuals and their families on Medicare, long-term care insurance, other health insurance related issues, and planning ahead for long-term care needs. So high cap also provides legal assistance or legal referrals in dealing with Medicare or long-term care insurance related issues. So SHIP or high cap counselors are trained in Medi-Cal and Medicare and can help you understand the complex insurance options to find the best fit for you. And you can also learn about the Medicare and Medi-Cal by attending community presentations or conferences conducted by high cap counselors. So hopefully that's helpful.
And I just wanted to offer a quick note that Medi-Cal is the California version of Medicaid. And so most other states, their state-run program is Medicaid, which is different than Medicare. Two different things.
So I think one thing that I want to kind of reiterate for our audience is that the plans are tailored to meet your needs, whether it's your health needs or your financial needs. And you work with the counselor to kind of find what's best for you. Is that how I'm understanding it, Dr. McKeever or Bruce? Is that really how I'm understanding it, that they will work with you to find the plan that best fits your needs?
That's absolutely the best reason to reach out and find some professional help. So that'll be a consistent theme in a lot of things I'll say tonight. But there are so many different options, and
Right.
finding the best fit is something that's important. There are new options, and they're changing every year. We'll touch on those in a couple of times tonight too.
Good, good. All right. Well, let's move right along. Dr. McKeever, you're dropping gems tonight. Just want to tell you. You're on fire tonight. Okay, so we're still talking about the ABCs of Medicare. All right, so let's talk about C and D. From all the ads on TV to well-intentioned advice from friends, where can people go to find trusted information about all of these advantage plans and prescription drug plans?
Well, that's an easy one tonight. You can start with Medicare.gov. It will help you compare all the plans available in your area. Medicare has what's called a plan compare. It's a plan compare online where you can look at your options, and even if you can even look at your prescriptions in pharmacies. So this year, more than ever, is vital that during Medicare open enrollment, which started on October 15th, that individuals review and compare their options to find the coverage that best meets their needs. So there are, for example, savings to insulin that are new, and we encourage everyone to shop and compare plans to be sure they're on the best one. And if you need more information, you should again reach out to a licensed health insurance professional or senior health insurance counselor through your state.
I just wanted to add that we're in the midst of annual enrollment period, the time that people would want or need to choose or change plans. And that starts October 15th and it ends December 7th. So time is of the essence. And those plans that people would choose during that period would become effective the 1st of January and be in place for all of the forthcoming year, 2023.
Absolutely. Yeah. So I know it seems like you have time, but there's no time like the present. Go ahead and get it done. It's open enrollment has already started. It started on the 15th. You don't want to wait to the last minute and have something go awry. Just go ahead, go to Medicare.gov and sign up now, or call that number. It's scrolling along the bottom of the screen there.
That's right. And Thanksgiving can put a real crimp in things. You know, you get done with that weekend and boy, you only have a week left. So
Yes. Yeah, so yeah, you do have to. Thank you for that, Bruce. You got to account for the Thanksgiving holiday, so just count that week as a loss, right? When you got friends, you got family, you planning food, all of that stuff. So just get it done now before you start getting close to Thanksgiving. So, Dr. McKeever, you mentioned insulin specifically. Can you speak more on that?
Well, we have some really exciting news relating to insulin. We know that so many people are impacted by diabetes. And we know that there are many populations that are disproportionately impacted by diabetes, and the cost of prescriptions to manage the disease can be costly. But starting in 2023, people with Medicare won't pay more than $35 for a month's supply of each covered insulin. And I'm going to repeat that. People with Medicare will not pay more than $35 for a month's supply of each covered insulin, and that is huge for people who need insulin to manage their disease. So deductibles also won't apply to covered insulin. This means that even if someone hasn't met their deductible for the year, they still won't pay more than $35 for a month's supply of each covered insulin. And more specifically, beginning January 1st, 2023, people enrolled in a Medicare prescription drug plan will not pay more than $35 for a month's supply of each insulin that they take and is covered by their Medicare prescription drug plan and dispensed at a pharmacy or through a mail order pharmacy. So this includes insulin that is delivered through pens, vials, or pre-filled syringes, as well as insulin delivered through newer disposable insulin pumps, or patch pumps as some people call them, and deductibles will not apply to covered insulins. So people with Medicare who use insulin will want to ensure that the plan they select covers the insulin that they need. And I can't underscore how important this is, and what a major change this is for people with diabetes. And we're excited, we're excited to see people take advantage of that.
Dr. McKeever mentioned Medicare.gov earlier, and one of the great things that Medicare.gov has is also a formulary search tool by insurance plan. And so when she was just describing covered insulin, um, the drugs that you might be taking for insulin or any other the drugs that you're taking can be entered into their search tool. So you can see which plans match up, which plan formularies match up with the drug that you're actually taking. And that's not to say that there might be another brand or another type of drug or generic version of the drug that you're taking that might match up just fine. But that's always a good place to start, is just to make sure that when you're looking at plan options, the ones that have in their formulary the drugs that you're currently taking is a very powerful tool to use on the Medicare.gov site.
But well, I want to say, Dr. McKeever, that is fantastic. I mean, that is some fantastic news, because we all, I mean, if you've been watching the news at all, we know that that has been a fight politically for whatever reason. I'm not going to get into that. I won't touch that. But we understand that capping that price, capping that insulin is going to help people with their budgets and also save their lives, because we know that if they're not getting that insulin, then their diabetes can run out of control. And there's a host of problems that can come from uncontrolled diabetes. And so there's millions of Americans that need that insulin and just can't pay, exorbitant prices for it. So thank whoever did it. I don't know how they got it done, but thank you for getting that done. We're very, very appreciative of keeping a cap on that insulin. So moving on, Bruce, at Cedars-Sinai, you offer Medicare eligible patients resources to get assistance with selecting a Medicare plan. Tell us more about that.
Well, we do a number of things, particularly during this time of year, but we also reach out to folks that we know are turning 65 that happen to be our patients. So we kind of take two routes. And we're big fans of trying to put people in touch with resources that are knowledgeable about helping them. And so some of the things we'll hit later on will resonate with what I'm saying now. And that is, finding the right plan with the right benefits is a very important first step. However, finding a professional that can choose the right plan that includes the right physicians for you, or the physicians that you like using, and understanding how the benefits that you might choose link up to being able to access those providers in a covered way becomes important. And so it's not just the benefits, it's being able to use those benefits with the providers that you'd like to use. And so I want to emphasize the importance of not just becoming aware of what benefits are out there, it's what benefit plans specifically would fall into the category that matches up with your providers. And so what we do is, through our communications, particularly at this time of year, we do two things. One is we try to express to the community at large a schedule of meetings that are conducted by local insurance agents that we've partnered with, who conduct meetings about the benefit plans that they operate with, that we know also that Cedars-Sinai works with. And then when we communicate at scale, when we're marketing the call to action, which is really this time of year, is that you should be engaging with somebody who can help you with this, is that we work with a company that's a national agency called eHealth, or eHealth.com. And we'll have in the ticker here at the bottom of the screen the contact information. But for people in Los Angeles or around Cedars-Sinai, in particular Cedars-Sinai patients or people who have used Cedars-Sinai in the past or would be interested in using Cedars-Sinai, we have a phone number for eHealth that's 844-671-7314. That's 844-671-7314. One of the great things also about eHealth is that you don't really actually have to talk to a person. A lot of people, and you still have that option, but you can go online to their website, and we have a special Cedars-Sinai landing page for people who use the following, not email address, but website address, and that's ehealth.com/Cedars, and that's CEDARS plans. There's no space between those. So it's ehealth.com/Cedars plans. And that will take you to the eHealth page that it contains just the plans that Cedars-Sinai contracts with. So that'll be a first good start, and you can look at the benefits that are available from each of those plans. And then if you find that you have a question later, you can always pick up the phone and then dial them. And that phone number, I'm sure, will be made available when you're looking on their website. For those of you who are not in the Los Angeles area or are interested in using other providers not named Cedars-Sinai, thank you. It's that number, the 877-957-8022, or ehealth.com/BDO for blackdoctor.org. Thank you.
Well, thank you for that. I mean, that's some fantastic information to get people some help to navigating the system. We are very, very appreciative at BDO for the partnership with Cedars-Sinai. So, it's kind of cool to have our name on the end of an eHealth plan. So thanks to our partners at Cedars-Sinai to really help people get through this process. So, Dr. McKeever, short and simple, do all doctors take Medicare?
Well, the vast majority of doctors and hospitals do take Medicare. However, some enrollees in Medicare Advantage plans may need to stay in their own network or area. So if you have a particular doctor or a specialist or hospital that you want to continue using once you're on Medicare, it's important that you find a plan that includes those options. So most do, but you have to be careful that you get what you get the services and that you're looking for.
Okay. All right. So I'm going to give you a scenario. So, all right, let's say I found a plan where I can still see my doctor and still use my favorite hospital. So I got two checks. I can still see my doctor. I can still use my favorite hospital. Once I am enrolled, am I set? Can I go ahead and start scheduling my annual wellness visit? What happens once I get the right plan?
So once you get the right plan, you're set for that plan year. But like all medical insurance plans, change is inevitable. So healthcare providers may move in and out of plans. So it's important that you review your coverage every year to be certain that you are in the Advantage plan that is the best fit for you. And Medicare open enrollment takes place, as we mentioned, between October 15th and December 7th each year. And during this time, you can join, switch, or drop a plan, and your coverage will begin on January 1st, as long as the plan gets your request by December 7th. So for Medicare Advantage plans, there's an open enrollment period from January 1 to 31st each year. And during this period, if you're enrolled in a Medicare Advantage plan, you can switch to a different Medicare Advantage plan or switch to original Medicare. And you can also join a separate Medicare drug plan once during this time. So note, you can only switch plans once during this time. The bottom line is, don't pick a plan and never look at it again. Be sure to review your coverage annually to make necessary changes. And even if you are happy with your current plan, it's still very important to check for changes each year and compare other available plans. You may even find plans that save you money, so it's important to stay vigilant.
Okay, so I know some folks might feel some kind of way about that. So I'm gonna making changes once a year. So what if something happens and I really need to make a change sooner? Can I do that, or am I just kind of stuck with, because life happens in a year. It's 365 days. A lot can happen in a year. Would I be able to make some changes if I needed to make something sooner?
That's a really important question, Ellis, and thank you for posing that second scenario. So under special circumstances, you can enroll in a new Medicare Advantage plan or the Part C plan that we talked about when you said the alphabet soup, or a prescription drug plan. So that's the Part D, outside of the open enrollment period. So there are a few circumstances that may dictate that. So moving to a new location that is outside your plan's coverage area, losing your current health insurance coverage, changing coverage from an employer or union. And the other one would be, if you meet one of these criteria, you may be eligible to enroll in a Medicare Advantage plan without a penalty. So there are some special circumstances that will allow you to change But again, you have to stay vigilant and make sure you're in the best plan. I don't know, Bruce, if you had any experience with that you wanted to share.
Thank you. Yeah, there was one other thing that sadly we've become a little more aware of in California in the last few years with fires and droughts. But one of the things that enables one of the periods that during which people can change plans is during federally declared emergencies. And so there are times during the year that during federally declared emergencies that are even open enrollment can be extended. But in any case, they call these special enrollment periods. And so if you are living in an area impacted by a federally declared emergency, then that could also provide an opportunity to change plans.
Well, that's some great information. And I do want to so some folks, especially if last year was your first time, or if this year was your first time and you're kind of banking on what you've been hearing about what happened last year. Last year, there was an extension for open enrollment, but that was due to the extenuating circumstances that came under COVID, right? And so that extension has not happened this year. So you do have that October 15th to December 7th. So I want to help people understand that. So that extension was a temporary one, and now we're back to our traditional open enrollment.
Exactly.
So Miss Betty, let's learn from Miss Betty right quick. Tell us a little bit about how Medicare enrollment went for you. What are some of the things you considered in picking your plan? And are you reviewing your plan annually to make changes?
Okay, that's a lot of questions.
That's a lot of questions. I know.
Thank you for inviting me and able to enlighten you on what it's like to be on Medicare. I had no problems. I enrolled on Medicare.gov. It was fairly easy. There's once you enroll, that's it. The government has your name, they have your information, and they are going to be in touch with you. So they will send you all the paperwork and everything that you need. But the one thing you have to remember, you have to enroll before you're 65. And you have to enroll, and it has to be 3 months before you're 65. To do otherwise means that you will be penalized. I got my prop here. This is the Medicare and You 2023. Each year, you'll get a manual from Medicare that will explain all the things that change. And if you look at 2023, one of the things that has changed on the inside is they got what's new and important. And instead of having to enroll 3 months before your 65th birthday, you can now enroll in the month of your birthday. So that way you won't forget, because you do not want to be penalized by the federal government. When I considered my plan, I had to look at my lifestyle, my overall health, and I wanted to stay with the highly rated hospital and doctors that I was seeing, who's begins with Cleveland. And I knew that I would be traveling and I would be going to other states. So what I did, I chose the other Medicare plan, not the Medicare Advantage plan, but the original Medicare, because with original Medicare, I could go to any hospital and any doctor that I wanted to go to. And I did not retire at age 65. I continued to use my employer's health care. You can do that. And because I was a Medicare age and had enrolled in Medicare, my Part A was free. So what that meant that whatever the insurance plan did not pay, then Medicare would pay the balance. So I was covered. So those are the things you have to consider. And of course, there's a financial issue too. It costs a little more to have the original Medicare, but you have to weigh it against what you need from your insurance plan.
I think you bring up a good point, Miss Betty. So I'm going to stay there. I think we all have budgets, right?
Right.
I mean, we're not Jeff Bezos or anybody that Bill Gates or anybody that doesn't have to worry about finances. We all have to worry about, most people have to worry about their finances. But I think you worry less about your finances if you're healthy, right? And so Medicare, it should be one of those expenses. Your health, you should have an investment in your health. And if Medicare can help you, uh, give you peace of mind by helping you stay healthy, then I think that's a worthy investment versus, and we have to just find a way to include our health in our budget. And too many
Right.
people don't do that.
And that was a big part of the plan.
Yeah.
And I didn't just start thinking about it at retirement age. I was thinking about it years before I was going to retire. Like, what do I really need in order to maintain my health and my lifestyle?
Mm-hmm.
And I decided that it was more important than a new car or anything else, that I would be able to get the kind of care that I needed. But there's ways to work the Advantage plan as well. And in the new, I don't know if anybody else has this, because I always carry this with me. This is always with me. Because as soon as I haven't read the whole thing, but in the back of it, if I can show this, it may not come out. But anyway, they have all the Medicare special needs and Medicare Advantage plans listed in this manual for the state of Ohio. So my assumption is that everyone who is on Medicare that gets one of these, in the back of that, they have all the Advantage plans for that state listed. And you can go through there and you compare prices and co-pays and deductibles and all that. But once you're enrolled each year, you'll start to get this Medicare and You. And it will go through a lot of things and questions that you may have and you may forget because your memory is not as good as it used to be. But with this, you can go through and find a lot of your answers.
That is fantastic. Dr. McKeever, Bruce, what advice do you have for somebody, an end user like Betty? Where should they start to make that process easier in their community?
So I was pausing just to make sure Dr. McKeever didn't have anything to say. Betty had mentioned something that's important about your intentions to travel and then cost. And I think those are important considerations when you're becoming 65 or at any time. Things could change even after you're 65 and decisions to travel and do things. So one of the things that I've noticed in the few years that I've been working with Medicare Advantage plans is on the HMO products, you're generally covered for emergencies when you're outside of the plan's service area. So in California, that's usually outside of California. And they also provide international emergency coverage as well. In Los Angeles, this is now the second year, and so the products are continuing to evolve. But we're noticing that large insurance companies are coming out with Medicare Advantage PPO plans. And those large plans cover more than emergency. So if you had a cough, sniff, and you weren't in California, but were in Tennessee instead, you don't have a broken arm, don't have to go to an emergency room, but you still could go to one of the providers on the plan, and it's a big plan, and still receive coverage as if you were in Los Angeles. And the benefit plans can be even richer than what's provided with most Medicare supplemental plans and a lot cheaper. So those are also some new market innovations that are still happening. And there might be a happy medium in between that. And so if you're working with an insurance professional, those are important things to ask about.
Okay.
And I'll just add, one, thank you so much, Ms. Goodman, for sharing your success story with Medicare. And I think it's important for people to hear that, there are things in things that they have access to make the process easy. So I appreciate you sharing your story. And what I would say for someone, what can help with the process is going to Medicare.gov, which is where, what you had talked about as well. Also, your state Department of Aging, and as I mentioned earlier, licensed insurance brokers. I will note that we're really excited that we were able to expand the Medicare and You handbook. I love the prop that you had with you. When I saw your prop, I asked my team for one too. I want mine so I can so I can have my copy to carry around. But you
Yeah.
know, we expanded the languages to additional languages for this publication this year. So that was a really exciting you know, expansion that we had for it. But again, thank you for sharing your experience, because I think it's helpful for people to hear that they can go through this process and, you know, find the things that they need.
Yeah, and you have to review these plans annually. The only time I've changed the plan, I changed it last year because the Part D drug coverage in the plan that I had almost tripled, and I'm like, what's happening? I'm only taking a tier 1 drug, you know.
Right.
And what I ended up doing was it was better for me to take a drugstore plan and pay the copay and still come out cheaper than what I was paying for a premium where I, you know, had no copay. So those are the things I'm saying, is that each year you have to look at those costs and those prices and compare those prices. And sometimes you have to do a little juggling to get it where get the cost down.
Yeah. Yeah. Okay, so we've heard this throughout the night. So Bruce, I'm coming to you. All right. Real quick, if you're just joining us, we are talking to Dr. LaShawn McKeever from the Office of Minority Health at CMS. We're also talking to Mr. Bruce Young, who is the director at the basic plan services there at Cedars-Sinai. And then we're also talking to Ms. Betty Goodman, who is a Medicare user here. So we're talking all about open enrollment. Open enrollment started on October 15th, and it's going to end on December 7th. So there's a short amount of time, about a month and a half, to sign up for Medicare. So Bruce, all right, so we've heard about the insurance brokers, all right? Why should somebody use one? What does it cost? Because we know there's cost to everything. What does it cost? Is the cost worth it? Are they just trying to sell, and upsell me so they can get a higher commission? Talk to me. Give it to me straight, Bruce.
All right. So let's be honest. It's a business.
Okay.
But agents should not be charging you anything. They get paid by the insurance companies.
Okay.
And then I think an important thing, and I get this question a lot from my coworkers who have parents who are new to this and wondering, you know, what is this all about and what do we have to do? And I'm sure if you wanted to bake chocolate chip cookies for them, they would be very happy with that, or some iced tea. That would be wonderful. But they want you as a returning client, and good agents will reach out to you every year. And we all know that everybody's mailboxes this time of year, not during an election year, get packed full of mailers, even some of ours with my name on them, that are just trying to encourage you to reach out to somebody. And then, of course, there are lots of agents who make an entire living. This is like CPAs during tax season. We don't sleep. And I don't sleep because I'm helping those agents answer questions from Mr. or Mrs. whoever who might have questions about Cedars-Sinai. And so they want you as a returning client, and you might be happy because, you know, one of the things we've emphasized during this call is that things change every year. You heard Betty say it. And there are oftentimes better coverage opportunities in future years. One insurance company may offer 5 different benefit plans in any given year. And next year they might offer a 6th, and that 6th might be the best one. And believe me, those insurance companies are not going to reach out and say, hey, there's a better plan. Go ahead and choose this one instead. They're very happy to have you stay on the older plan that doesn't have as rich of benefits. And they're all competing, the insurance companies, in every single market. And so they're trying to outdo their competitors by offering you something better. So, you know, less copays for physician visits, reduced copays for certain drugs. In Los Angeles, most Medicare Advantage HMO plans don't have any premiums at all. And almost nothing or 0 copays to see doctors of any type. And so I think the key issue there is that they work on commission. They're there to help you. They are salespeople. That's how they make their living. But they are there to actually help you. And they're doing a disservice to themselves if they're not helping you get lined up on the best plan for you. And so they're an active resource for you as the years go by. And I think that's an important role that they'll play. I think that's the bottom of my list. So thanks, Ellis.
So, Dr. McKeever, real quick, if somebody, because even Betty talked about it, she didn't stop working at 65.
Mm-hmm.
So how does somebody manage that process if they're still working, they still want to use their employer's plan? Should they still sign up for Medicare?
So this is a scenario where you need to speak with your human resource department to find out the rules for your employer-based plan. Sometimes your employer may require you to sign up for Medicare. So if you plan to continue working into your Medicare eligible years, it's really important to know the rules of your specific situation. So we recommend starting with your human resources department.
Absolutely. Bruce,
perfect answer, Dr. McGeever, and thank you for that. And so there's one tip that I wanted to offer, and I even find high-ranking executives here who end up having this question because they want to keep working here. It's a great place to work. And so with when Part D for drugs was started, there was a thing called a letter of creditable coverage. And so your employer, during every open enrollment, will include, or should, I think by law they have to include, a letter of creditable coverage if their benefits meet federal guidelines for prescription drug coverage. And so what I wanted to share with everybody that's listening tonight is you get one of those every year. And it's important to hang on to those because, as Betty had said earlier, late enrollment sometimes comes with penalties. And if you can document that each coverage year you had a letter of creditable coverage, that will help you sustain a position that you should not be penalized for late coverage because you had creditable coverage through your employer during those years that you didn't enroll with Part D when you joined Medicare. So that's just an important thing.
No, that's a fantastic tip, right? Because somebody might want to work through until they're 67, 68, 70. We know people are working longer in life. And so they're like, oh, I'm good. I got great coverage, and then not get that letter. And then they might be penalized because they didn't sign up for Medicare. So that is great information. So what's it called? A letter of credible coverage?
You got it. Yep, that's exactly it.
I'm taking notes over here. I got it. All right. So this has been a wonderful conversation. If you all have any questions from the comments, I'm going to check those momentarily. But if you have any questions, we've got the best right here on this program right now to get your questions asked and answered. So if you have any questions, please drop those in the comment section. If not, I've got some more questions I can ask. Here, I'm full of questions. So Bruce and Dr. McGeever, let's talk about why our viewers watching tonight might want to change their Medicare Advantage plan. So maybe they're not happy with the plan they got. And Betty talked about this earlier when she said, hey, look, she made a change in her plan. It was for a specific reason. So what are some reasons that people might want to switch their plan?
Bruce, do you want me to go first?
Please.
Awesome. So there are many different reasons that someone might consider changing their plan. So for example, costs, and that's something that Betty, that you mentioned. How much are your premiums, your deductibles, and other costs? Coverage. So how well does that plan cover the services you need? Your other coverage. So if you have other health or prescription coverage, you want to make sure you know how it works with Medicare. So we talked about talking to your employer benefits manager before making any changes. Prescription drugs, that was one that came up. Do you need that type of drug plan, and what will your prescription drug costs be? Doctor and hospital choice. Does your doctor accept the coverage for that plan? And if not, that might be something that you need to consider. Do you need to get referrals? Quality of care. Are you satisfied with the care that you're getting or not? And travel. So this came up already. If you frequently travel outside of your network area or outside of the US, you may need to purchase supplemental insurance, and Medicare typically doesn't cover care outside of the US. So remember, I think we've kind of underscored this, that every plan is different, and some Advantage plans are HMOs, and you're limited to a closed network of providers, and you may need a referral to a specialist. Or other Advantage plans are PPOs, where you can use doctors in network to save money, but you can also use any provider that accepts Medicare. So it's important to discuss your specific needs with your advisor or broker and reevaluate your plan annually. I don't know if you want to add anything to that, Bruce.
Those are all excellent points. And so there's a couple of things I wanted to underscore that you said already, and then add a few other considerations. And so one, your choice of providers can change annually. We're dealing with that in Los Angeles right now, where there's another major provider that's not named Cedars-Sinai that is changing up its plan participation, and that's affecting one major plan. So all the members in that plan that use that provider hopefully are engaging someone to help them change or understand that provider. They'll need to either switch benefit plans that may be more expensive in order to keep that provider, or they have to change providers completely if they want to keep the plan that they have. And so provider choice from year to year is just almost as well, I would say it's probably more important than even prescription drug changes. And so, or formulary changes specifically. One of the things that I wanted to talk about is that people's experience with something that might seem like a restriction might actually at times be helpful. I am not of Medicare age yet, thank you, but still a lot of gray. But I have been sick before. Mm-hmm. And while some people think about being locked into a network and having to get referrals to use particular specialists or particular types of specialists, might seem like a restriction. And I maybe this is a Cedars-Sinai thing and not an everybody thing, but we have a high degree of care coordination people here that help people navigate the system. And if you weren't part of our system, you wouldn't have maybe a social worker reaching out to you to help you find the right person to be referred to. And it would be a specific person or maybe a group of people that work in a medical group that are specialists in the kind of care that you would need. If you didn't have care coordination with a plan that was just like a Medicare supplemental plan, you don't get that assistance. It's up to you and your doctor, and the fact that the doctor, the specialist that he's referring to happens to be his golf buddy might be the main credential. And I'm just not sure that's always the best thing to do. And so having assistance from your provider organization, a quality provider organization, oftentimes can be a benefit and not a restriction. And so HMOs are not necessarily four-letter words. And plus that, you get to save all sorts of money. But that's those are, I think, some important considerations year to year.
That is fantastic. So we are coming up close to the end of our time here. It went by so fast. We got a lot of information in, but I only got time for one more question, and then everybody will give their closing statement. So this question is going to go to you, Dr. McKeever. What is CMS doing to help keep the Medicare system strong for the next 50 years? I mean, if you pay any attention to the political discourse, Medicare is always kind of in that push-pull that's happening between the left and the right. I'm not going to get involved in that, but what is CMS doing to keep Medicare strong for the next 50 years?
Well, thank you for that question. So there's actually several key Medicare related health provisions in the Inflation Reduction Act. That includes, for example, requirements for drug companies to pay a rebate to Medicare if they raise their drug prices at a rate that is faster than the rate of inflation. We talked about the cap of out-of-pocket costs for covered insulin for people with Medicare at $35 a month for a month's supply of each covered insulin product in Part B and D, beginning January 1st, 2023, and for Part D, July 1st, 2023 for Part B, and no deductibles for these products. Also, it eliminates cost sharing for vaccines recommended for adults in Medicare Part D, Medicaid, and CHIP. It requires Medicare to negotiate lower prices directly with drug companies. It protects people enrolled in Medicare D from high out-of-pocket drug costs by eliminating cost sharing in the catastrophic coverage phase starting in 2024 and capping annual out-of-pocket drug costs at $2,000 in 2025. So all of these will help Americans see more affordable plans, covered insulin, and covered vaccines. And this is something that we are really excited to be a part of this discussion today, to just share all of these opportunities to get coverage and to know, that it's really important that you have the right plan that meets your specific needs.
And that is fantastic. And we are just so happy to hear that, right? Because we want to make sure, no matter who's in office, we'd like to think that as Americans, we'd like to be able to be healthy and have the opportunity, if we have to go see a doctor or just get screenings done, that we have the opportunity to do that, particularly those that are 65 plus. And so we want to keep Medicare strong and we want to keep it going for, because I'd like to be able to use it. Much I'm sure Bruce would like to be able to use it like Miss Betty, and take advantage, no pun intended, of the Medicare plans. So as we're wrapping up, I want to give everybody opportunity to give a final statement. So we'll start with you, Miss Betty. What's the last thing you want to say about Medicare?
Well, I think it's a unique program to this country. And I think we all should be appreciative that this country goes that far to take care of its senior citizens. And I don't think we could have gotten this level of care unless we had something like a Medicare program. So,
well, amen to that. Bruce?
I couldn't agree more. Thanks, Betty. So first, get your annual wellness visit, and they call it annual because that means every year. And the sooner you get it in your year, the better off. And so it's just always good to make sure that your care can be properly quarterbacked by your primary care physician. And I think that's a seriously important thing. Tonight, we talked about Medicare.gov as a website that has all sorts of great tools, and everybody who is considering the entering into Medicare coverage should always check that first. It's a great tool that helps just provide an initial level of understanding of what the options are. But sooner or later in that process, you're going to be asking for help, and find someone to help you. Find a professional that understands how to link up what you've seen on Medicare.gov with you and your grouping of providers that you would like to see, and then choose the right benefit plan. And those folks can help you with that as well. So I think those are the key things.
Thank you for that, Bruce. Always a professional. Love it. And finally, Dr. McKeever.
So I'd like to end the night by saying, thank you for having the Office of Minority Health at the table for this important discussion. We know that there are so many communities that, are disproportionately impacted by different types of diseases and things that impact their quality of life as they age. And having health insurance is an important part of enjoying the rest of, the latter years of your life. And so we want to encourage people during the Medicare open enrollment period, which began October 15th, but will go through December 7th, to go to Medicare.gov to begin that process, because this is an important opportunity for you to get the right plan to meet the needs that, your specific needs. So again, thank you so much for the time this evening, and we look forward for future opportunities to engage.
Well, absolutely. And I'm going to, as we're closing here, thank you so much to our partners at Cedars-Sinai for this informative discussion. Thank you to Dr. LaShawn McKeever from CMS, and to Bruce Young from Cedars-Sinai, and of course to Ms. Betty Goodman, our fabulous Medicare patient, for joining us today for this community conversation. I think our viewers are going to remember to check their Medicare health and prescription plans every year for changes from here on out after watching this program. So if you're almost 65 Make sure you're getting signed up for your initial enrollment period for Medicare, and that you spend time comparing plans on Medicare.gov to be sure you're getting the plan that is right for you, where you can use the doctors and hospitals you want to use. And again, if you're a patient of Cedars-Sinai and you want help enrolling in Medicare, call the Cedars-Sinai eHealth line at 1-800-844-566-0190, Monday through Friday from 5 a.m. to 5 p.m. Pacific time. We'll be sharing resources in our comments. I've already put some in there. And so be sure to check those out. Thank you so much to Cedars-Sinai, and from all of us here at blackdoctor.org and Daily Vitamina, I wish you all a good evening.
Thank you for having us.
Thank you.